Hello, everyone. My name is Jadmina Lexi, and my presentation today is going to be based of Escherichia coli, which is one of the most frequent causes of UTIs. What is Escherichia coli? Escherichia coli, also known as E. coli, is a gram-negative bacterium that is mostly found in the lower intestine. E. coli can also be found in the gastrointestinal tract, which is where the stool is located. Although these bacteria can be transmitted sexually, you don't always have to be sexually active to have it. What is the urinary tract made of? Right here we have a picture of the urinary tract. So to answer the question, the urinary tract is made up of your kidneys, the your ureters, the bladder, and the urethra. Right here, as you can see, this is your pair of kidneys right here on the both the left and the right side. And right here we have the ureters, which is also located on both sides. Now, the ureters are the tube connecting the kidneys to the bladder. And right here, you can see the orange tube, and you can see it on both sides too. And it shows how it's connected from the kidney and all the way down to the bladder. And right here, we have our urethra, which is the tube that carries the urine from the bladder to the outside of the body. And right here, this is the bladder right here, which is located in your lower quadrant. And right here, all the way down, you can see the urethra too. E. coli is usually present in the human body. However, it is harmless to our gut. But once it enters your urinary system, which usually comes from the stool, and gets in the urethra. Now, what is urine made of? Urine is made of water, salt, chemicals, and other waste. Even unhealthy urine can host a variety of bacteria, except for the E. coli. Right here, I will explain this picture right now. This is the vagina opening, and this is the urethral opening. This is the anus. And the reason, so in women, it's more likely to get UTIs in women than it is in men. And the reason for that is because the anus is so close to the vagina. As you can see right here, there's a really short distance in between those two. And when you look at the men's anus, it's and you look at the distance in between, it is longer compared to the woman. And how can you get bacteria from your anus to the vagina? Is by wiping back to front, which is why you never wipe from the back to the front, because when you do that, your so there is usually E. coli in the stool, which is in the anus. And when you do wipe from the back to the front, you carry all that bacteria from the anus to the vagina, which then gets in the urethral opening and then gets into, which is, there's the urethra opening right here, then gets into the bladder, and then can affect the whole thing going up, which can affect the whole thing right here, the whole ureter. And when you don't get that treated, that's when it gets worse. Cause then you can get a whole bladder infection right here if you don't go for treatment for your UTI. or you can even get to the point where you get kidney problems, because remember, your kidney is connected to your bladder by the ureter. Here are some symptoms in men and women. In women, they usually have the urge to urinate a lot, or a very burning sensation when using the bathroom, frequent passing of very small amount of urine, or a very strong smell, very unusual, and you will notice it right away because it's a very unusual smell. You will get pelvic pain, or any unusual bright color. And men, you also get the persistent urination, also a strong smell, dysuria, and signs of hematuria, which is blood in the urine. Right here in these pictures, you can, right here, up here, you can see how the urethra, when it's getting infected, which means there is a bacteria in the urethra. And right here, you can see how the man and the woman body, like their anatomy is not much different from each other, because they both got the pair of kidneys, they both got their pair of ureters, which are located in the exact same place, and they both got their bladder right here in the urethra. This is a graph that shows the number of kisses there is at least a year in the US. There is about 7 million office visits a year. That is a lot. 1 million ER visits, and over 100,000 hospitalized. About 10 out of 25 women and 3 out of 25 men have developed symptoms in their lifetime, which I had showed earlier in that one picture. How, and this is why women get it more often than men, because the urethra opening, it's just so close to their anus, so all the bacteria, it gets transferred. And this is not the only way to get it. You can also get it from sex, and it's when you're being sexually active, and you use when you also use the anus, and then don't wipe, and then go and use the vagina opening, which then you're transferring all these E. coli that were sitting in the anus to the vagina. You can also get it from pregnancy, which, because you get hormonal changes after growth of bacteria. Um you can also get it from birth control, because it kills the healthy bacteria that usually protects you from E. coli. So when these bacteria are being killed, then the E. coli takes over, which then makes more bad bacteria than good ones. Um and right here in this graph, I actually got it from the National Library of Medicine, and there is my source right here if you do want to go and check it out. What causes UTI? UTI is caused by microbes entering the urinary tract and cause infection. Although bacteria is the main causes for UTIs, living mostly in the bowel, fungi can but rarely infect the urinary tract. Like I said previously, women are mostly affected by UTI because the urethra is shorter than a man's and makes it so much easier for the bacteria to get into the bladder. UTI are not transmissible, but it is highly very much highly recommended to avoid having sex when you know you have a UTI or when you are having symptoms of UTI, because all it's going to do is irritate the urinary tract, which then is just going to push even more bacteria into the urethra, which will just worsen the infection. So why go all this way? Because at the end of the day, and if you don't get it treated, it's just gonna keep on getting worse, because remember, if you don't get it treated with antibiotic, it will just infect your kidneys and your bladder. Treatment for UTI. Like I said before, antibiotic is what's used to treat most UTIs. And here, down here, there is a few other drugs, but it is highly recommended when you do go to the doctors, they will prescribe you antibiotics. It is very important, again, to take the antibiotics prescribed by the doctors so that the infection don't worsen. Although if left untreated, it could go away on its own, which is not likely for most people. But it can also turn into kidney or even blood infection. Right here are my sources, and the first one I used to learn more about E.coli and um how they actually how they affect the body and where they're actually found. And this one right here, I actually use my notes from Meet the Microbes to know a little bit more. And right here, I use this source right here to get my graph and also get the number of hospitalization for urinary tract infection in the US. And sorry, in the this one right here, I use it to learn more about bladder infection, how it happens and how to treat it and all that. And then the last one right here, I used it to learn even more about UTIs, how to treat it, and what were the symptoms. Thank you very much for listening to my presentation. I hope you learned something today. And please, if you are having any type of this, um, if you're having any type of these symptoms right here, I highly recommend going to see a doctor, because it can get very bad, and I wouldn't want that for anybody. It includes both men and women. Thank you. If that shit ain't 10 minutes, bro.